Hey everyone, it's Emery here at Homestead Horsemanship, and this is an exciting day. We are heading into the vet with Miss Beauty here. We're gonna go get a pregnancy ultrasound to find out if she's gonna have a little Oliver baby. And then we're also taking Happy. She's got a little bump on her. We gotta go get it checked out. We're not sure what it is. We're taking Patty in just for a general health check, and then Legacy is going with us also for, he's just gotta get updated Coggins. So we are really excited to see what this day holds for us. We're gonna take you along. Here comes Becca now with Patty and Happy, I believe. Here comes everybody off the hill. We have Maddie, Bernadette, Pippi, Amber, Boots, Lady, Fraulein, and Lakota. As you can see, Miss Beauty is very, very dirty, but it rained all day yesterday, last night, so just how it is right now. It's pretty early in the morning, so we just didn't want to waste the time getting her a bath. We can do one later, but also it's just what happens around here when it rains. So we just got to the vet. Things got busy at home, so I didn't get much unloading. We ended up leaving Patty because there's not quite enough room in the trailer with the stallion, so we'll bring her at a later time. And then on the way over here, we blew a tire and had to stop at Doolittle Diesel. TJ helped us out really quick. He got a tire on lickety split, and we made it just in time. We're a few minutes late, so we're just here unloading everybody now. We actually have Becca's trailer with us today. Needs new tires, I guess. I guess Beauty's gonna go in first. So we're having Dr. Berger look at these two bumps that we found on the Happy. There's one right here, which you can visibly see.
Well, you can see the other one.
Yeah. Well, on the camera you can't.
Camera, you can.
Maybe you can. And then there's another smaller one above it.
It's
so
really hard.
Yeah. She's looking older. She's 2 years old.
I know.
Or wait. I don't remember her birthday. It was in May.
No, it was April.
April. So yeah, she's a 2-year-old. She's little, but she'll probably grow more. Becca says Beauty looks like her mommy. She's starting to fill out a little bit though, but she looks like she has a lot of growing to do, so. She's never been to the vet. She's never been anywhere.
Has she been anywhere?
She's never been off the farm. Has she ever loaded in a trailer before?
No.
And I missed it. Did she go right in?
I pushed her.
You pushed her in? The benefit of a small horse.
Well, no, the benefit of having really broke babies.
Yeah.
She was able to go up behind her and just pushed her really hard. And
Her mane's getting long.
You're stepping on your head.
We are too excited, and I'm sure you guys are too excited to find out if Beauty is pregnant, so we're going to go right into the ultrasound.
Small, palpable swelling. Could be a friend there. Let's see what the ultrasound says.
Woohoo!
It can be misleading though. I don't want to speak out of turn.
Well, she's confusing because if you take her away and put her back in, she does.
Bifurcation was where I felt a little enlargement. So let's just go to that with the probe and see what we see here. So right ovary has an apparent CL and numerous medium follicles. Here's the right horn. That's the circular object in the center of the ultrasound screen. The enlarged, little bit swelling area I felt was right there, and I don't see a pregnancy in it. Okay. But there's a pregnancy just to the left of that.
You scared. That was not
what I thought I felt, it was just to the left of what I thought I could feel. So there's the pregnancy.
Oh, is that spine?
No, but you can see the heart fluttering right there. That's just placental structures.
Oh, okay,
but if you see right in there, you'll see a little fluttering action, and that's the heart. Can you see that?
Yeah.
Let me see if I can get a little better image for you. There, right there.
Okay.
Stutter gelding. Stutter mare.
You pick, and you got a 50-50 shot.
So can you tell how far along she is?
I can give you an estimate.
Okay. Yay, beauty!
In the ballpark of 5 weeks.
Oh, so not very far along. Okay.
5 weeks, 4 days, plus or minus 4 days. It's not a perfect science.
Okay, so I'll go look back and look at our dates of when I knew she.
But you're in
couldn't
that
mate.
ballpark. Let's make sure we don't see a buddy.
So that means she would
good.
have taken on that second heat cycle that Isaac said he saw them breeding. Yeah, I bet that's right.
Oh no, that is the enlarged. It moved a little bit. The uterus folded a little bit, so that is the enlarged area. So yeah, no, that's exactly what it's supposed to.
So it looks healthy
Supposed
and
to be.
stuff.
Everything appears normal at this time.
Okay.
How far along was the pregnancy that she lost?
We're not sure. We
How
found.
far
I
was
think it,
when we diagnosed it?
yeah, like the
100 days
third or
when we
third month.
diagnosed that she lost it.
Do you think
This
there's
looks
anything?
pretty normal. Usually, if you're going to lose one from lack of progesterone, we would have lost it already.
So you don't think like there's anything we need to do, like give her hormonal wise or anything like that to make sure to
We
help
can
her?
certainly check her progesterone level. It would be unusual to see a lack of progesterone and still have a pregnancy at this stage.
Okay.
That doesn't make sense to me.
Well, the last one, when you diagnosed her pregnant, it was oval, and you're like, oh, that should be round.
Yeah, and she was saying there was an abnormal appearance to that pregnancy. This has a very normal appearance to it.
Okay.
This looks like what I would expect.
Good.
Cool.
I don't have any obvious concerns. We see a visible heartbeat. We're in that 30, 40 day range. 35 to 45 day range is kind of what the computer program indicates. So that's about, and it looks like that.
Looks good.
It looks appropriate. It would be reasonable to recheck her at 60 days, make sure she still has it. Most embryonic loss is going to occur early in the pregnancy. So usually when you make it out to that 2-month range or so, boy, it sure seems like things tend to be what they're supposed to be.
Cool. Awesome. Good news.
congratulations.
Yay. Baby
What it's
Clydesdale.
supposed to be.
Yeah.
Yay. Good baby. Go ahead.
We are all super excited about Oliver and Beauty's foal. However, we were kind of worried about Happy and wanted to get right on to having Dr. Berger check her out.
Hey there. Hello.
She's overly friendly.
How are you?
Just a warning.
So with the hair off here.
It busted
kinda
open
popped.
almost there.
Okay.
But it's not shrunk since, and it's
Yeah,
almost
there's
a little bigger, I think.
Was there a known injury here?
No,
Not that we know
there's-
of.
So this
that
happened
was-
after
yeah.
the bump.
Yeah, the
Okay.
bump
The
was
bump
there.
has been there for 6 months with hair on it, and the hair thing
And
is
it
just
started,
the last 2
it
weeks.
started, both of them started like smaller than that. It was just like you could just feel a little knot with your
Okay.
finger.
I don't know for sure what it is
Yeah, it's weird.
at this time. The ways to find it out would be, number one, take a biopsy of it.
Yeah.
The 2 ways to biopsy it: incisional biopsy or excisional biopsy. Incisional would be, we would probably use a true cut needle and we insert that into the tumor. We take or the mass rather, I should say. We take a sample of it, send that to the laboratory, have the pathologist tell us what it is. The excisional version would be, we would make an incision over the top of this, remove the whole bump and send that in and find out what it is and find out if we got it all.
Yeah.
That would be the ways,
Can
ways
you
to do
can
it.
you do the incision with the grain where the scar won't show, or can you make it to where the scar won't show?
I would think so, because it's relatively round. I mean,
Let's do that.
normally,
You think?
just
think
from a space standpoint, we like to make the incision over the longest axis of whatever it is we're dealing with, but it's relatively round. So going with the hair flow,
Is it going to be that big of a
This-
cut or a little cut?
it'll be probably something like that.
Oh, baby.
Holy cow!
What
This
about
might
this one
be
up here
a
too, though?
silly question. Will that cause her to lose mobility in the shoulder, you think?
The surgery or the bump?
Either or.
Depending on what that is, possibly. Well, and so if that would, the hope would be it's like scar tissue, granuloma, something along those lines. That would be the hope, because then it's not any malignancy or anything like that.
So, if it's scar tissue, because you're not unsure, would it be beneficial not to cut her open and remove it first?
Correct. That's why we have the two different perspectives on how to figure out what it is. Incisional, do a true cut biopsy, or remove the whole thing.
What would you do? What's your
Young horse, how old are we?
two?
Just turned
Just
2.
Okay. I would lean towards the lesser invasive. So, to a degree, I misspoke. Incisional would, it's really more of a needle biopsy is the true cut.
Yeah.
I would lean towards doing the less invasive first. We spend a little bit more money potentially, because if we do the less invasive, the true cut needle biopsy, and we send that in and it turns out, hey, it didn't give us an answer, because when you take a small sample, sometimes you don't always get an answer out of it. It's an inconclusive result. So there runs the risk of either 1, not getting a conclusive answer, or 2, getting an answer that says, you need to go in there and take the whole thing. So in theory, it's possible we could end up spending more of your money to address that by taking the more or less invasive approach at first. It's also possible we may find out that's scar tissue.
Why would
Leave
there
it
be a
alone.
lump of scar tissue?
Trauma, injury,
Barbed wire fence.
ran into something, another horse kicked us,
Would we
another
just leave
horse.
it there forever then?
Then we could theoretically leave it, yes.
Would
Because
we want
it's-
to remove it, or would we want
Depends on your goal for the horse. If it's show ring and we can't use a breast collar that hides it or something like that, or if we're using a breast collar, it's rubbing and creating a problem, then yeah, we'd want to get rid of it. If this is a trail horse and we're not planning on going in the show ring, that's
Well, they won't
not
dock,
likely.
They won't dock a blemish in our shows anyway, 'cause
Okay.
it's all about the gate.
Okay.
What are you thinking that this?
I don't know.
You just
it's
don't know.
It's either a tumor or it's scar tissue.
Okay.
And the tumor could be benign, could be malignant. We're a young horse. Just thinking logically, we would expect it to be a more benign thing, scar tissue or a benign tumor. But my eyes are not a microscope, and so I don't want to inadvertently lead you down the wrong pathway by saying, the likelihoods of that being cancer are really low. They are really low, but it's not completely impossible.
Doggone it, Happy.
So it's kind of one of those.
Oh my gosh, there's another one.
That's the same.
They're spreading. There's another one. I just seen
Just
that
do
one.
whatever you
Starts
wanna
to
do.
scare. Yeah.
Doggone it.
I think we need to know what it is.
Yeah. Now there's another one that's just.
In theory, it could be infectious based. There could be like a tract
You
of
don't think it
infection.
could be like
there.
bot flies or anything?
I don't think so.
Well, this is
And
weird.
feeling what this feels like, can I get all that? I'm just thinking out loud here.
Yeah. No, you're good.
It almost, this one not as much. This
That
almost feels like it's getting into musculature.
Yeah.
So the question then becomes, is even doing an excision removal of it something that we should be doing here, or should this go to an actual surgeon?
We can just do the thing.
Do the true cut
Yeah.
biopsy first,
Let's do that.
the less invasive one.
How much is that going to cost?
Cutting it open, if it's scar tissue though, you'll be like, oh, it's scar tissue.
I won't know that.
Oh, you won't know that?
No.
Okay.
I will not.
Has to be
My eyes
biopsy.
are not a very good
I'll
microscope.
pay for the biopsy.
You really have to look at it in the
This is
microscope.
awful.
And you want a pathologist, a trained pathologist doing that.
Sure.
It's weirding me out, but there's more. I thought it's
Yeah,
not
it-
at just those two.
It gets my attention, absolutely. Absolutely gets my attention. So let's do a little shave here, sweetie pie. 'Cause we want to clean this. I sure don't want to cause infection.
Disinfecting.
This is surgical scrub, so it is disinfecting the surface of the skin, so we can do this. Yeah, that's going down the track. Yeah, they absolutely they have to give it up eventually. The others is
Right here, Dr. Berger is using lidocaine to numb the bump and surrounding areas before doing the procedure to make Happy more comfortable.
Horsehide is tough.
it is.
After shaving the area, we could clearly see there's a scar that runs across the bump, so we're hoping that indicates that it was an injury.
A little line there we noticed. So I'm really thinking this was a wound.
That'd be awesome.
Which, yeah, best case, and then that's probably either scar tissue, granuloma. There could be a walled off infection in that. That's a possibility too, so.
Dr. Berger ended up taking 2 samples. He felt the first one just didn't get quite enough, so this is the second attempt.
That felt better. Oh, that's a much better sample. So it's kind of cool. If people get squeezy, they won't want to look at this. But this needle has a trough in it. So when we insert this is back here. When we insert it in to the area of interest, then we advance the trough portion. Then we slide this shield over the top of it. That makes a cut. And then we harvest that tissue in the trough. So then you can see how it just peels right off.
Much bigger pieces too.
Yeah, this is a much better sample. So how that works was we have it assembled like so, insert it into the area of interest, advance this, then we slide the shield over the top of it, and that's what makes the cut and gets us our sample.
So that was it. Happy was done. She just had to wake up. She was very, very drowsy at this point. But we're praying that, this is only scar tissue and nothing more.
Need to see him go or anything for the
I
help?
just like to watch. I don't need it, but I like to watch it.
Trot. Trot. Trot.
So from Happy, we moved on to Champ, who I called Legacy earlier. But Champ just came in to get an updated Coggins, a general health check, and the papers.
You got a lot of foot, which is good.
Yeah. He wears size 2 horseshoe already.
Yeah, that's what I mean. He's got a lot of foot for his size.
And my farrier that does the competitions, Ruben, he said he has the best hoof anatomy of any horse he's currently shoeing.
Cool. I mean, realistic. Kind of make the joke that a foot on a horse is kind of like the footing of a house.
Yeah.
It's not going to hold up if it doesn't have a good footing.
If you're on our Patreon, then you'll know that last week we found that Champ's cheek was slightly swollen. And we weren't quite sure why. However, when Dr. Berger was doing the health check, he found that Champ had a wolf tooth coming through, causing the swelling.
Look at this one. See? Right there.
Oh, I'll be damned.
Yep.
You ain't got time to remove that, do you?
It was super tiny, just barely poking through, so JR had missed it, but it obviously was causing him quite a bit of aggravation. So after finishing up Champ's general health check, getting the blood for his Coggins, Dr. Berger did say that he would do a full dental on Champ. It would just be a little bit later in the afternoon.
Okay, Champ has to get his wolf tooth pulled. He only has one coming through. So we're gonna leave him here, go to lunch, and then we'll come back to pick them all up. We got Happy in there, she's waking up. Beauty's chilling out in this stall.
So it ended up being a long day. We arrived at the vet at 9 a.m. and didn't get back home until almost 3 o'clock. We did go ahead and separate Oliver and Beauty. Dr. Berger advised us to do that because he said the only way that Beauty would possibly lose her foal is if she was kept with Oliver and he was a little bit too aggressive with her. So Oliver right now is roaming this side of his pasture. He has it all to himself. I think he's pretty happy. And then Beauty is out with the herd currently on this side of the pasture. Champ did get that little wolf tooth pulled, and then we ended up having Dr. Berger do a full dental just to check that everything looked good and make sure Champ is comfortable while he's being rode. JR's giving him a few days off right now to heal up, and then he'll go right back into training. And then little Happy, we haven't heard back on the biopsy yet. We weren't given a time frame, so it could be, you know, a week or a little bit longer before we hear the results. But once we do, we'll definitely let you all know. And in the meantime, we're just going to be speaking positive thoughts and prayers and love over our sweet girl. So we had put Beauty in with Oliver the very end of February, and she was in heat at that point in breeding. But then around the end of March, we also thought she looked like she was coming in heat. And then on the 28th, our son Isaac saw Oliver breeding her. And from what Dr. Berger said, with the measurements from the ultrasound, she is 5 weeks along, which lines up exactly with that breeding date. So that would put Oliver and Beauty's foal arriving March 2026, give or take a few days. The window for a horse's gestation is pretty large. Average is 345 days, but they can go as early as 320 and hold these little guys hostages up to 362 days. So around that time, we'll just have to be on full watch so we don't miss it. Even though she had some issues with her first pregnancy, slipped that foal, we don't really feel a ton of concern. Dr. Berger thought everything looked good. She looked healthy. But we're definitely going to keep track of her progress, keep you guys up to date. And we're just going to have fun over this next year, watching her body grow with the foal and change, preparing to give birth to Oliver's first foal.